Hello, my name is Madeline Silva, and this is my week 14 scenario for KIN 241. So this is the Spring Lake Swimming Lagoon scenario. So we're going to start with letter A. So what type of water-related victim are you dealing with here? We're dealing with a drowning victim. Okay, now what do we need to ensure prior to helping this patient? So what we would look for is the patient's condition. So are they responsive? Are they able to communicate with us and aid us in our process of helping them? What position are they in? Like, are they submerged? So if they are, they would require basic life support as soon as we get them out of the water. Are they injured? Any like head or neck trauma? If this is the case, we would need to stabilize the neck and the spine before we attempt to remove them out of the water. So another thing we could look for is condition of the water. So the visibility, like how murky would the water be? Would be able to see the patient if they submerge later on in the situation. What is the temperature of the water? This is something we need to be careful of. If it's too cold, this could lead to hypothermia. And then water movement. Is it fast flowing? Are we able to safely get there ourselves without risking our lives as well as their lives? And then what is the depth of the water? Are we able to stand in the water, or do we need additional equipment to help us? And then our resources, are we the only responder? What is our ability to swim? Like, how well of a swimmer are we? If we don't have the best ability to swim, maybe going into the water might not be the best idea. It could put two people at risk instead of just the one. And then personal flotation devices. This is something that's recommended or practically required for every responder on site. And then finally, what type of assist would be the most appropriate to use and why? So in this situation, seeing as the young teenage swimmer was said to be in the middle part of the lagoon, in like the deeper area, assuming we're not trained in water rescue, the reaching assist would be the best approach for the situation. So with this assist, we're going to use an object to try and reach the victim. If we are unable to reach the victim, seeing as they're in the middle of the lagoon, we would then go and throw a floating object towards the victim. That way they can stay afloat while we find other ways to get them help. So before throwing this object, we want to make sure, of course, that it's tied to the shore. That way we can pull them in if able to. If we are trained in water rescue, before going into the water, you want to make sure that you are secure. So this would include like having a sturdy object to grasp that's tied to the shore. That way you're not swept away by the current, or don't get yourself in any troublesome situation that you don't want to be in. Another thing we can do is, if trained in water rescue, we can then go ahead and go into the water. But before we do this, we want to make sure that we ourselves are secure. So this could include having a sturdy object to grasp onto that's connected to the shore. So we have established that we can't throw an object to the victim. We would want to go ahead and row close enough to them, not close enough that they can go ahead and grasp the boat that you're on and tip it over, but close enough so that you can give them an object to reach out for and keep them afloat. So once you get there, you want to go ahead and assess the situation. So then this would again go back to assessing the patient's condition. So this includes like any injuries, like are they submerged? Do we need to perform ventilation in water, and then stabilize any neck injuries before we try and get them out of the water. And then we also want to keep in mind the method we use to remove them from the water. So we want to look at their level of consciousness, what size the victim is, like if they're going to be too heavy, like do you need further assistance and able to remove them from the water, any spinal injuries again, and then how close is advanced medical personnel. So this is something we want to keep in mind when attempting to remove the patient from the water. Once we go ahead and remove the patient from the water, if they require CPR, we want to go ahead and give that. Keep in mind the water temperature, like do they have hypothermia? Do we need to continue to try and resuscitate until further medical personnel arrive? And then we want to ensure that the patient is still taken to the hospital, because there could still be life-threatening conditions 72 hours after it has already occurred.